Hello, everyone. It's Monday, March the 8th, and appreciate you being with us and everything. Over the weekend, we have a reported total deaths of 7 in West Virginia. That continues to be, on one hand, amazingly good, but surely terrible for these great people that we lost and all their loved ones. And I'm going to read through them, and at the same time, I ask all of us in West Virginia and all across this nation that to keep these people in your prayers and your thoughts, and all their loved ones. It still continues to be a shame, but the numbers are surely better and encouraging. But at the same time, you know, it's sad. It's really, really sad that we continue to lose people in this great state. Our 2,319th death is a 79-year-old female from Clay County. Our 2,320th death is a 79-year-old male from Raleigh County. Our 2,321st death is an 83-year-old male from Putnam County. Our 2,322nd death is a 60-year-old female from Cabell County. Our 2,323rd death is a 40-year-old female from Lewis County. All these people are way too young, but 40 is unbelievable. Way, way too young. Our 2,324th death is an 86-year-old female from Mason County. Our 2,325th death is a 68-year-old male from Berkeley County. Again, many thoughts, many prayers. Don't let them become a number. 2,325 great West Virginians we've lost. We have seen a reduction in our deaths in the past 7 weeks now of 88%. So that part is really great. But we still really are going to miss, and we hate like crazy these families that are going through their suffering right now, and so please be with them. We have 182 new positive cases in the last 24 hours. Our daily positivity rate was 3.41. Our cumulative positive rate now is below 5.4, it's at 5.38. Our active cases are down to 5,613. That's 51 straight days that they've gone down. You know, our recovered cases are 125,689 cases, and if you'll see the top chart, how it continues to widen, that's exactly what we want to have happen. We only have 178 people that are hospitalized in West Virginia now with COVID, and only 41 in the ICU units, and no red counties in our state. All good stuff, all encouraging stuff, but don't drop your guard, West Virginia. We still got a ways to go. If you'll look at that map, you know, of our color-coded map, I think that's, put that back up, Jordan. That's amazing. I mean, when you look at that, it is unbelievable to see all those green counties, and that's really, really good. If you're 65 years of age or older, please remember that if you get some kind of anything that you think is unusual, an unusual feeling, whether it be that sniffle that I've talked about, or a headache, or tiredness, or whatever it may be, you have got to treat this as if it were a heart attack or stroke symptom, and go get a test. You don't have to fly off to the emergency room, but go get a test. They're free, they're painless, and if by chance, you know, you were to come back positive, we can give you antibodies and we can knock this thing out right off the get-go. Remember, that's exactly what happened to President Trump. You saw him bounce back in 3 days. So absolutely, please remember to do that. We've lessened a bunch of restrictions and everything. We've done that. We've done so a couple of times in the last couple of weeks. You know, we've lifted the capacity restrictions on restaurants, bars, small businesses, retail stores, gyms, fitness centers, and more. And as long as we keep that social distancing, we can maintain this. I've raised the number of the social gathering limit to 100 people. And I've permitted now that we're going to allow our travel youth sports to continue, to go back to playing, provided we're not in red in the county that if we have a red county, that county cannot do travel sports. From the standpoint of our guidelines, I want you to continue to know we're going to continue in West Virginia to wear a mask for a while, and I don't like it, but it's just what it is, and we all know that if we don't watch out and we move too quickly, we could have some level of whiplash, jump back on us, and that would not be good. From the standpoint of, they're sending me one thing here. All the stuff with our gyms at schools and our gymnasiums there and everything, we're following the guidelines of the SSAC there. So they're kind of, they're that in the Department of Education are telling us what to do with, our sporting events and so on like that, and our gyms, in regard to schools. Our workout gyms and everything and fitness centers are back to 100%, and I already mentioned that, and everything. Okay, our vaccine distribution update. We're at 95.4% of our first and second round doses, and our goal is always to be at 100%. Our saving our wisdom clinics are going on in all 55 counties. We have now a total of first round and second round doses. We have a total of 556,283 doses that we've given to people. Since last Friday, we administered 23,478 doses over the weekend. This week, we will be expanding our federal pharmacy partnership in West Virginia to include the Medicine Shop, Leader Works network of all pharmacies. West Virginia continues to lead the nation. We've dropped down a little bit in the world ranking. We're 12th in the world. We don't want to drop down, and everybody knows my feelings about that. All of our medical experts and our team and everything, everybody knows where I'm at on all that. As far as our vaccine scheduling system, we still encourage any and every West Virginian age 16 and above to pre-register. Right now, we are administering vaccines to all West Virginians over the age of 50. We still are backing up and trying to get all the people that are the 70, 65-year-olds first and foremost. We have counties that need now to increase their pre-registration, and I'm reading those counties to you. And if you're in one of these counties, we've got to have you increase your pre-registration and everything. It will only help your county and help your people. But these counties are a little more numerous now, and that is Gilmer, Calhoun, Clay, Wirt, Doddridge, Webster, Pocahontas, Grant, Pendleton, Braxton, Wyoming, Pleasance, Tyler, Tucker, and McDowell counties. These counties are kind of through the gut of West Virginia and everything, and not just stuck up on the northern or the eastern panhandle. So we've got to have you step up and get pre-registered as well. We've registered 350,000 West Virginians since we started, and all that's good stuff. Like I said, as far as our Saving Our Wisdom clinics, all across 55 counties, that's good. Names are continuing to be pulled from the West Virginia COVID-19 vaccine registration system to fill appointments. I want to super encourage everybody that's age 65 to absolutely, you've got to get your vaccine. And so far, there have been 195 individuals that are in excess of 65 years of age that have received this vaccine. No telling how many thousands of lives we saved by moving when we did in West Virginia. There's been 114,874 that have received both shots. Good stuff. And I again commend all those that are really the foot soldiers that are making it happen, from the standpoint of how our support has been in our communities and our county, clinics all over the place, and all the health workers that have done great stuff. DHHR, the National Guard, they've been fabulous beyond belief, and we just thank them and continue to thank them over and over. From the standpoint of our vaccine info line, of course, it's up, vaccine reminders and everything. Please absolutely understand, you can't get COVID from taking this. Quit listening to the silliness that people pass around. You know, I make fun of it by saying you're not going to grow antlers, you know, if you get this vaccine. But there's a lot of people out there that are scaring people. And you know why they do in a lot of instances? Here's exactly why they do. You know, misery loves company. That's all there is to it. Just think about it. Misery loves company. And a lot of these people are flat miserable all the time. But what they want to do is they want to convince you that they're not going to take the shot, so therefore they don't want you to take it. Well, why in the world? Why? Why wouldn't you take this vaccine? Why wouldn't you just look around and try to find somewhere where the vaccine has gone adverse? You know, surely there's situations out there, but tell me of how adverse it is when every single day people die and people continue to die and everything. Please don't listen to that junk. It's just junk. That's all there is to it. We want to thank, special thanks to our drive-through pharmacy people and everything, the Fruth and Walgreens, a special thanks. You know, there was a reason, if you'll step back from this, there was a reason that 88%, that we got to an 88% reduction in deaths in West Virginia. Why do you think that was, West Virginia? Why do you really think that happened? Do you think that happened because the ozone layer changed? Or do you think that happened because the planet Mongo? That happened because we put vaccines in people's arms. And at the end of the day, that is turning the tide. So why are you standing on the sidelines saying, well, by God, I'm not going to take a vaccine shot. And they can't make, well, we can't make you. We can't make you. But why are you doing that? And if you choose to do that, I'm great with you doing that. I'm absolutely fine and dandy with you doing that. You know, the old idea that, you know, you can only take the horse to water, you know, so I'm fine with you doing that. But where it gets not fine with me is people beyond maybe your immediate family that you absolutely have any right. I mean, you got a right to do whatever you want to do. But really and truly, this idea of just going out and spreading the news of the misery, you know, that absolutely that says, I want company. I want company. I'm not going to take this, and I want others around me that are absolutely not going to take it either. And then all of a sudden, what happens is just exactly what happens with the situation that was described, I think, by Secretary Crouch. Imagine this. Imagine. You know, and this was at one of our assisted living places. But after giving the vaccines, we have not had one person in that facility and everything, that assisted living facility, not one person has gotten COVID, except for the 8 staff members that didn't take the vaccine, and every last one of them got it. I can take the horse to water. I can't make you drink. Absolutely, with all in me, you're making a big mistake not taking this vaccine. In our long-term care facilities, we are down to 7 outbreaks across this entire state. It was well over 100, you know, a few weeks ago. From a church's standpoint, we still have 1 outbreak in our church community, and that's in Nicholas County. You know, I encourage you to continue to do the great stuff you've done in our church community and keeping that pew in between you and maintaining some kind of social distancing and wearing a mask. You've done so good. Keep it up. Keep it up, West Virginia. In corrections, we see again how this thing can move and move very, very quickly. We have 265 inmate cases and 11 staff cases, and those include 215 of the 265 at the Western Regional Jail, 48 at the Southern Regional Jail. I encourage you to still wear your mask when you go outdoors. You know, that executive order has not been lifted. When you go outdoors and you go in a public building, you know, we expect you to have the mask on. And again, I don't get it. I don't like this either. I don't like it a bit. But absolutely, how big of an inconvenience is it? I mean, if you're out in a public building, how long are you probably going to be in the public building? 30 minutes? 45 minutes? You know, and how often are you going to be out in a public building? Once every other day? Well, is this the end of the world? You know, wear your mask, please. Give blood, give plasma, and absolutely we'll update you very, very, very soon as when we're going to go again with another town hall in regard to the personal income tax elimination in West Virginia. And you know, just one other thing. I think every single person that's watching will at least admit one thing. I don't tell you anything but the truth. I never tell you anything but the truth. I have told you along the way over and over what was going to happen in regard to stimulus packages and everything else. It's happened. It's happened over and over. I have absolutely never, ever told you anything but the truth. Now, here's the thing, and we need all of your help, all the public's help, because whatever soapbox there is in the world that's out there, some politician is going to grab the soapbox and stand up on it and everything and try to do his or her thing. Absolutely, if you believe I'm telling you the truth, remember just one thing in regard to the personal income tax. The program that we now have put together is going to put more money in your pocket. I don't care who you are, it's going to put more money in your pocket. Now, you've got to believe that, and you've got to know that. With all in me, we have worked this thing so many different ways. The people that were struggling the most, we gave them a cash rebate check. Now, if you don't want the cash and you want to stick your head in the sand, then I can't help you. But if you want more cash in your pocket, this personal income tax elimination plan will do that for every single West Virginian across the board. And what else it'll do? It'll bring you opportunity like you can't imagine. It'll bring you the opportunity that you've been looking for. West Virginia, the only state in the nation that has lost population, the only state that continues to lose and lose and lose and lose more population. Now, if you want to turn into a state park in West Virginia, and you want to always know that Aunt Edith can't have a picnic on, this coming Sunday and everything, the reason she can't is all of her grandkids are in Denver and Atlanta and all across our country. Probably a lot of them in Tennessee. And probably a lot of them in Tennessee because they don't have an income tax and they're thriving like crazy. But if you want opportunity in West Virginia to raise wages, to absolutely see your home values go up, to absolutely see people moving into West Virginia and bringing jobs and bringing opportunity, this is what we got to do. There's two things for certain that are going to happen here. I will guarantee it beyond belief that West Virginians, all of you, will be putting more money in your pocket. And the second thing is all of you will see more people come to live here, bring job opportunity and everything. Again, I can't drag you. Absolutely. All I can do is tell you the truth. This is what we need to do today in West Virginia. And you got to help me out for us to be able to get there. Nevertheless, that's all I got today, and we'll let you know about when we're going to have another town hall. And I really welcome all your questions and everything because it only makes us better. Thank you so much.
All right, thank you, Governor. Let's now go to retired Major General Jim Hoyer, the Director of the Joint Interagency Task Force.
Good morning. As the Governor talked about, we continue to make progress with our vaccine distribution and administration. We still have some tweaks that we're working on, and we're starting to work on parallel distribution paths going forward as more vaccines come in. Vaccines continue to come throughout the week. On Friday, we actually received 32,000 or 35,000 vaccines Friday evening. So we continue to work through the distribution process and moving vaccines into arms. Governor's given us clear direction to get shots in arms as quickly as possible, and we'll continue to move forward with that. A couple of initiatives to address some of those challenges is we will be working with various groups this week on clinics for our industrial-based partners, manufacturers, mining industry, because we know it's difficult for them to get messages for appointments during the day because they're not able to use cell phones during the day. So we'll be working that initiative. We have some initiatives that we'll be rolling out later this week to help to continue to get that over 65 population, and particularly those who may be grandparents who are working or who are taking care of children as a result of the opioid epidemic that we faced as a state. A big week this week to get teachers over 40, working with the State Department of Education, those large clinics, just like we've done before. Also, there is an initiative going on over the next couple of days where call center personnel made up of DHHR, National Guard, FEMA volunteers will also be calling individuals over the age of 65 who still have not received the vaccine to continue to get that population done as quickly as possible. We appreciate all the work, as the governor said, from our local, state, and federal partners as we continue to move forward with this effort and continue to get vaccines in arms and reduce those death rates and hospitalization numbers that the governor laid out. Thank you.
Thank you, sir. Next to Dr. Clay Marsh, our coronavirus czar.
Well, good morning. And support and to reinforce a couple of things that the governor mentioned and that General Hoyer mentioned. I think the governor has, in a very smart way, followed the data, and that's what we're all trying to do. You know, one of the hallmarks about West Virginia is that we have not been afraid to follow our own data and make decisions that weren't just decisions that are made because other people are seeing different things in their state, but really decisions are made because of what we are seeing in our state. As the governor said, our week-to-week mortality has gone down by 88%. We have fewer West Virginians in hospitals than we've had since November or so in 2020. Same for ICU patients and ventilated people on mechanical ventilators. And the opening up the capacity restrictions in a number of our businesses, I think is very important. We know that the economy and jobs and education and health all go hand in hand in hand. And as we are very cognizant of, maintaining the safety and the well-being of all of our citizens, we also know that keeping the state together, as the governor has done very well, has been a critical feature of our success as well. So as we do to be very diligent about, protecting yourself, protecting each other, still maintaining the discipline of face mask wearing and physical distancing, particularly when you're out and as the mandate suggests, when you're in public buildings. The Centers for Disease Control just are releasing their guidelines as far as what vaccinated people can do. And good news for a lot of people that if you're with other people that have been completely vaccinated and are 2 weeks after their vaccines, those of you, if everybody meets that criteria, can meet and not worry as much about physical distancing or wearing masks. And that's okay indoors as well per the new guidelines. And for grandparents and for family members, even meetings with a single family with low risk of getting COVID that might include people that haven't been vaccinated is okay for all to be without mask and to also not worry about physical distancing. Again, small, single family, low probability of infection, even when some people have not been vaccinated. But for the big groups of people, and when you go out, even if you've been vaccinated and you're finished 2 weeks after the last dose, it is really important for you to go ahead and wear your mask, protect yourself, protect others. We know these vaccines are tremendously effective, but we also know that there have been cases reported to the COVID variants going around. Nobody who has been reported, and that's from Minnesota and Oregon, has gotten really sick at all from what may be a reinfection. But it does make us have to be cognizant that we still need to keep our guard up. And as we are, as General Hoyer said, identifying all of our West Virginia residents who are eligible to get the vaccine now, in particular our older residents that we know are at particularly high risk of hospitalization or death, it is so important for us to maintain our discipline in wearing masks. And please, as the governor said, if you get an opportunity to get vaccinated, please choose to get vaccinated. These are miracle vaccines that are making a huge difference, not just in West Virginia, but across the United States and even across the world. So please choose to get vaccinated. And thank you, West Virginia, for all that you're doing individually and in support of each other.
All right, thank you, Dr. Marsh. Secretary Bill Crouch and Dr. Ayn Amjad are also joining us today and are available for questions. We'll now go to questions from members of the media. The first today from Steve Adams with Ogden Newspapers.
Hey, Steve Adams with Ogden Newspapers here. Senate just passed this weekend the $1.9 trillion coronavirus relief package, and I believe the House is set to approve the changes the Senate made as early as tomorrow. So I wanted to get your thoughts on that, because that's going to be a lot of money coming to the state. And a quick follow-up question to that, too. There seems to be a provision in that bill someone brought to my attention that basically says states shall not use the funds provided to either directly or indirectly offset a reduction in the net tax revenue of such state or territory resulting from a change in law, regulation, and yada, yada, yada. And I was curious to know whether that might affect anything in regards to the tax plan. I know you had talked about putting some money in some buckets or a third rainy day fund. So if you can answer both of those questions, I'd appreciate it. Thank you.
All right, let me answer these, Stephen. And first of all, the first question, I think, is in regard to the stimulus dollars. And I've said over and over that I feel like that, and this is just fact. I mean, we wouldn't have a reason for another stimulus package at any amount if we did not, in fact, undersize the stimulus packages that we've done in the past. We haven't gotten there, have we? And so there's a need for another stimulus package. I frankly believe that really and truly, a bigger stimulus package at this point in time is what is needed to finally get up the steepest part of the mountain. Now, I am an absolute adamant believer that we ought not be bailing out pension funds and doing things that don't have anything whatsoever to do with COVID and everything across our land. And to be perfectly honest, our federal government has a way of putting in so much pork into the situation that it honestly it's a terrible mistake, but it's what happens all the time. At the end of the day, I still believe that we need to go big or not go at all. Because we've still got too many people that are out there across, especially West Virginia, that are hurting. Even though we've done a lot of good things right here in West Virginia, you still got people that are hurting, people that are struggling with their rent or their car payment or their utility bills, people that really need to be drawn back into the system, because a lot of what's happened, they didn't have anything to do with. They were good, hard-working, good people, And they absolutely are victims beyond belief. Same way with a bunch of small businesses, right? You know, whether it be our restaurants or whatever like that, where people are mortgaging their homes, doing everything in the world to keep their business alive that's been in business maybe for generations and generations. That's a shame. And we need to go big to be able to get them to right-side themselves. And now, with all the stuff that's going on with our vaccines and everything, we're all so optimistic and hopeful that things are going to be good. Now, in regard to, you know, provisions that have been written into the law, now just think about this just 1 second. Because I want to tell you this, and this is terrible. This is absolutely terrible. But what was written in the law was written in there primarily by Joe Manchin. Joe Manchin is supposed to be your representative, West Virginia. And you know what Joe Manchin is doing? He's still trying to hit at me. That's all there is to it. When it really boils right down to it, that's all Joe Manchin is doing. He doesn't care about you. He doesn't care about the people of this state. Literally, Joe Manchin is selling his influence and making money. I mean, you think about this. Joe Manchin has been a politician forever, yet he's a rich man. How could that be? How could that possibly be? You know, absolutely, he makes money selling his influence. But in this situation, he is absolutely bent back double, triple to try to hit at me for some reason. For crying out loud, you know, for all practical purposes, I ran against him in the last election and won every single county in this state. Salango was just the puppet working for Manchin. And when it really boils right down to it, what he's doing is hurting West Virginians. It's just a slap at West Virginians. Now, Stephen, I want you to know just this. My additional rainy day bucket had nothing and still has nothing in the world to do with taking CARES money and putting it over here in a rainy day bucket that is for tax relief. Nothing at all. Nothing whatsoever. What it does have is just this. When we are it is our right, as other states, to draw down stimulus money that's been given to us, to draw that down, to pay us back for expenditures that we have expended towards COVID. All states have a right to do that. If we have just happened to run our state better than other states that are absolutely run by Democrats and totally out of control, if we have run our state better, you know, if in fact we have done that, you know, should we not have the options to do with those monies whatever we want to do with those monies that will only help West Virginians and help us become better and bring more and more opportunities to us? Really, when it really boils right down to it, what Joe Manchin is parading around doing is he's basically telling West Virginians, you don't want to do this. You know, the reason you don't want to do this is because Jim Justice came up with this. Are you kidding me? Are you really kidding me? West Virginians, we don't want you to have more money in your pocket. West Virginians, we want to continue to keep you in your place, keep West Virginia losing population. Keep you in your place, West Virginia. Is that the message you really want? I mean, what I am trying to do is bring increases in wages, bring job opportunity, increases in your home values. I am trying to do everything in the world that I can possibly do to help, and you know that, West Virginia. Just step back from it and just think one step further. You know, the man that could absolutely change things right now with his vote, came out just the other day and said the person is going to be heading up the energy side and everything, the Department of Interior or whatever it really was, and I'm not sure exactly that, but the person that's going to head it up adamantly hates fossil fuels and is on record of doing so. What does your senior senator say? They've got my vote. I don't get it. But this is all about just that. It is all about just petty nothing. Just nothing. That's why that was written in there. That's all there is to it. Any other way you cut it, that's the only reason that got in there. And it doesn't, and in all honesty, it doesn't have one thing in the world to do with what I was talking about. You know, I just think it's just as straightforward. It won't affect anything to do with what I've proposed. You know, I would always say you got to be smarter than the dog to train the dog. That's all there is to it. And in this situation right here, you know, I don't know why in the world we would continue to hit at West Virginia and try to take stuff from our great people in our state. And it is absolutely terrible. Nevertheless, that's it.
All right, thank you, Stephen. Next to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11. Been trying to get on the DHHR website this morning. I'm having some trouble, so I don't know if it's on my end or on the site's end, if there's any problems connecting. Some anecdotal messages from people across West Virginia, again, regarding senior citizens 65 and older who are having a hard time even following the general's directions and calling the toll-free hotline. There seems to be some disconnect between what General Hoyer wants people to do as far as on the hotline and what the hotline workers themselves are doing. So, General or Governor, is there any way to cut through the noise and to communicate directly to the DHHR workers that are manning those phones exactly how you want them to handle these calls coming in? Because I'm being told that counselors are saying, can't help you. You have to wait your turn. They're in some cases, they're hanging up on some of these older West Virginians. And so I'm wondering if anything can be done to have some quality control to where you are getting the message out that you want to get out through those people who are actually answering the phones. Thank you.
Well, Kenny, let me say just this. You know, the customer's always right. And the customer is our elderly people that are calling in. At the end of the day, I'm sure, and I've got all the confidence in the world that General Hoyer and his entire team and all the people that are, you know, that all of our experts and everything are doing great work. But the customer is always right. And evidently, somebody's displeased with what's going on. And so we got to do better. That's all there is to it. I'll get into it, Kenny, and I'll keep pushing it on my end. I'm sure General Hoyer will and Dr. Marsh and everybody else, but I am a total believer the customer's always right.
All right, thank you, Kenny. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. Could we get a little bit more information on the most recent pharmacy expansion? How many locations is that? How many doses in total? And how are folks going to get notified? I know when we initially added on Walgreens, the calls came from them. So how are people going to get notified about those shots? Thank you.
General Hoyer, this is you, sir.
Yes, sir, Governor. So, Charles, 59 independent pharmacies are being added to the group. It looks like right now about 5,000 doses to those 59 pharmacies, and it will be similar to the rollout with Walgreens, where doses go directly from the federal government to those pharmacies, but we in the interagency task force work with those pharmacies to identify the appropriate individuals to receive the vaccines, and then those pharmacies have the ability to call those individuals directly.
All right, thank you, Charles. Next to Mark Curtis with Nexstar Media.
Good afternoon, or good morning, rather, Governor and staff. Governor, let me go back to the Senator Manchin thing. Are you taking issue? I mean, he was the critical vote in the House passed $400 a week in federal unemployment benefits. Senator Manchin basically sided with the Republicans in the Senate, saying $300 should be the amount. Do you think that is, you know, was his key contribution to this? And how do you think that would affect West Virginia? And did you favor the larger amount of $400 in unemployment supplements?
Well, Mark, think about this just a second. You know, in the waning days of the Trump administration, you know, and this came directly from the President of the United States of America. You know, he said, nobody in my office will take Joe Manchin's call now. You know, absolutely what Joe Manchin has done over and over and over is he flaunts in front of the media and everything that he's bipartisan, middle of the road and everything yet, and even stands up at my State of the Nation, you know, and or State of the Union, you know, message and everything, and jumps up right in front of me and is applauding and everything when the Democrats are not applauding. And at the end of the day, when it comes to his vote, he's never there. He's never there. He's always done exactly what Schumer wants him to do. Now, with that, all that being said, a vote to change from $300 or $400 to $300 is a way to get your name out there. It's a way to get some notoriety. It's a way to look like you're semi-bipartisan. To be perfectly honest, in my opinion, it doesn't matter. It is absolutely, it doesn't matter, except to those people that are going to receive that dollar. From the standpoint of the overall stimulus package of $1.9 trillion, is it substantial or not? Well, it doesn't matter. It didn't matter. But it does matter to notoriety, doesn't it? But you know who it matters to, Mark? It matters to the person that is struggling to pay his rent, or it matters to the person that is struggling to buy something extra, or maybe be able to take his kids to the Dairy Queen. It matters to them, doesn't it? Absolutely, to me, it's another slap in West Virginians' face. You know, we should have done the $400. Absolutely, it was just a slap for no reason, you know, and it's a showboat deal. It's a political deal. It's what it is. It's all about politics. It's all about getting your name out there. It's all about implying that you are the swing vote. And so if you're the swing vote, well, I'll tell you what, I'm interested in, you know, being, you know, I'm the swing vote and everything. What do you think's going to happen? Money. Bring me the money. You know, I mean, Mark, you know what goes on, and I do too. You know, at the end of the day, this has got to stop. This has got to stop because we're just hurting West Virginians.
All right, thank you, Mark. Next to Paul Mullen with WCBC.
Good morning, Governor. Good morning, panel. First a comment and then a question. Governor, I want you to move away from talking about antlers because since you've been doing that, I have hit 2 deer with my car. I'm happy that Mark Curtis did not grow antlers. I may have hit him. But if you do move across from antlers, do not go to horns or tusk, okay? My question.
Paul, wait a minute, Paul. Okay. Paul, you got to stop right there. Let me tell you this. If you would have hit Mark Curtis or Jim Justice, either one, it would have totaled your car.
I may be there. Okay.
Okay.
Thought we'd have a little fun on a Monday morning. Anyhow, I wanted to talk to Dr. Marsh about the reasons that we may be getting lower rates of transmission. We are still in an indoor setting for most of us. And I know we do have the vaccine out there. Is another component possibly that a lot of us had COVID, were asymptomatic, and are immune to it now? Kind of a herd immunity thing. Dr. Marsh?
Governor, you good?
Oh, yes, sir. Please.
Okay. Well, I loved your story. You cracked me up. So I think that's certainly possible. You know, it's really very, very interesting. In certain parts of the world, the death rate and the infection rates are starting to change some, whereas in other areas of the world they're not. And if you look at parts of the world where we're seeing higher death rates, the richer part of the world in some ways are seeing per capita higher death rates than some of the poorer parts of the world. And so, what I would say, Paul, is that as we have said the whole time through, we continue to learn about COVID. Certainly, we believe that vaccines are at least an important component of the reason we're seeing the number of deaths go down. People have been, I think, really good about wearing masks as well, which has been important. But clearly, we are underestimating the number of people that have been infected with COVID-19. And that's just because we're not testing everybody, and not everybody's going to get tested. And as we've said, many of the infections are relatively mild, particularly for some people. So I think that's a reasonable hypothesis. We know that real herd immunity would be about 70 to 85% of the population infected. And almost certainly we don't have that much of the population who's been either vaccinated or who has recovered from COVID-19. So, but the more people that are immune, it does slow down the transmission rate some. So that certainly could be a component in West Virginia. But I think the key is that as we continue to learn about COVID, we want to remain very, very committed and disciplined about wearing the mask and staying physically distanced and doing the things that we know protect ourselves and each other. And when you have a chance to get a vaccination, please, please, please choose to get it. It is life-saving. It will reduce the variants, because if the virus can't infect people, the variant, and particularly from getting sick enough to be hospitalized or dying of COVID.
All right, thank you, Paul. Next to Kelsey Soto with WSAZ.
Hey there, Kelsey with WSAZ. I know last week we opened up a lot of the restrictions on bars and restaurants to 100% capacity, which was exciting for a lot of people and establishments. But I'm hearing from a lot of business owners that it really isn't going to change much for them, since they still have to social distance. They can't bring back those tables and chairs that they removed to spread out. Do you have any plans to sort of work with small business owners on how to make this work, or any plans to help them figure out a way to actually get to 100% capacity?
I think, Secretary Crouch, could you help me a little bit with this one? Maybe you can help me a little bit, or maybe General Hoyer. Go back to General Hoyer, but one of you guys help me a little bit with this one.
Yes, sir, Governor. This is Bill. We are looking at those. What we're trying to do is maintain some level of safety for folks, and as we open up. So wearing masks and continuing the social distancing is important as we go forward. We are, and the governor has a great his finger on the pulse on this in terms of how quickly we do this. So we want to be cautious as we go forward, and not just do what Texas did or other states did. We want to make sure that our citizens are safe as we go forward and we open things up. So that will come, but we're watching numbers and listening to Dr. Marsh and listening to Dr. Amjad, and we're looking at the science on this as we usually do. Thank you. Good question.
Let me just add one thing. We need to keep that social distancing. I mean, the social and the guidelines are, we just think what we want is common sense. We don't want people running around with a 6-foot stick and measuring how that you're 5 foot 11 inches away and you need to be 1 more inch away and all that kind of stuff. But the biggest thing is with common sense. Just think about the bars. When the bars, take all the seats away and everything, and people are standing piled on top of one another and everything, that's not good. It's just not good. And so let's just continue. I mean, let's crawl before we walk here, and as we're easing our way out of this, let's not do something that just causes something to backfire right in everybody's face. But we're watching it real closely and everything. We want you to use great common sense and everything, and we'll get there.
All right, thank you, Kelsey. Governor, I'll turn it back to you to close out.
Well, okay. just a couple things real quick. First and foremost, I've gotten a lot of cards and a lot of emails in regard to the little dog that we lost and our companion Lucy. It was not baby dog, it was a little Boston Terrier that we'd had for 12 and a half years. And like I said, she slept in the bed with us every night, and really good little dog and great companion and one of our family. And so I really appreciate all the cards and all the emails. And again, thanks so much. And for all the condolences that were expressed, very, very, very kind of all y'all and everything. And the only other thing that I have is just hang tough, West Virginia. We're close. We're closer than we've ever been to being able to crawl out of this and everything, but just still be just a little cautious and concerned, and use great common sense about what you do, and let's not have a whiplash on this. We don't want one single person to end up going through this dreaded death, and we're going to have people that, a few that are continuing to do that, and it's terrible beyond belief. Can you just imagine not being able to breathe? Is that not tough enough? Can you imagine not being able to be with your loved ones and not be able to breathe? It is really bad. So the biggest shot that I can shoot across your bow is don't let that be you. Just don't let that be you, West Virginia. Just a little bit longer with this crazy mask, just a little bit longer with all the stuff that we've got to do, and we'll be there. Just hang tough, West Virginia. You've done great so far. I really, really appreciate your confidence, and I appreciate all of us staying together. So let's stay there. I'll never tell you anything but the truth. I'll make a bunch of mistakes, and when I make a mistake, I'll tell you and everything, but I'll never do anything but tell you the truth, West Virginia. Thanks so much for giving me the honor to lead you. Thank you.